we're going to have to move on to our next speaker. Is equally amazing. That's Hillary Golden. She doesn't need an introduction to this community because she has delivered many keynote speeches to different foundations. Like Patricia, Hillary is a visually impaired individual from glaucoma as well. But like Patricia, she didn't let that diagnosis define her. She combined her own experience. She was in the medical field for over 2 decades, and she is a patient now. And she utilizes her experience and her expertise to the fullest extent. And she founded Glaucoma Coach in 2023. And she's on the mission. She's delivering the message, start with the patient. So we're so privileged to have her to walk us through what she means by start from the patient. Helen.
God didn't give me glaucoma because he thought I'd be quiet about it. Advocacy has turned into a calling for me. There's a higher purpose that drives me. I've learned to weather multiple storms in life, something we all must do. Glaucoma is one of these such storms. Through the storm of glaucoma, I've learned so much. There's been a lot of talk about the definition of glaucoma at this meeting. What I've learned, my definition is sight loss due to damaged optic nerve. It's that simple. Almost 5 years ago, I was diagnosed with severe normal tension glaucoma. I went to an optometrist with a sty, came out of that appointment with a severe glaucoma diagnosis, having lost almost 40% of my sight. Came from left field. Nothing made sense. I was in shock, broken. Felt like a 10,000 piece puzzle, and I didn't think I would ever be whole again. But I picked myself up and started putting the pieces back together, one by one. I shared my story. Other patients began to reach out to me. They asked me to help them put their pieces back together too. And I did. I helped however I could. Just over 2 years ago, I founded my company, Glaucoma Coach. There were too many missing pieces that needed to be filled in with patients. I saw a need and have been working to fill it ever since. It starts with a support system. As glaucoma patients, we hear things all the time from people who are well-meaning but have no understanding of this disease. Things like, well, you don't look like you have glaucoma. This one always gets me because, I'm a glaucoma patient, but I still don't know what that looks like. So, not sure exactly how to take that one. Another one is, why don't you just get glasses? And I say, well, actually, there's a big difference between sight and vision. So even though I've lost 40% of my sight, my distance vision is 20/20. So I don't need glasses to see far, and glasses won't bring back my lost sight. I also get, your eyes are kind of red. Have you heard of this great new drop for red eyes? Actually, yes, I have. I use it every day. It's a glaucoma drop. Glaucoma is usually a slow-moving disease. You lose sight slowly, and suddenly, all at once, you notice missing pieces. What I've learned is that some patients need to know more about glaucoma, the facts, the figures. They want studies. They want explanations. Some need emotional support. They want to talk, cry, and grieve the loss of their sight. What they all need is someone to listen to them. Someone who understands what they're going through, even when their close family has no idea what it's like. I listen to them, and we create a plan to start moving forward. I work with patients to remove the stigma of glaucoma and shift the narrative from one of fear and scarcity to one of hope and faith. We face many challenges as glaucoma patients. First, is the treatment worse than the disease? Sometimes yes. In the days after I was first given drops, my eyes became red, itchy, irritated, and they burned when I put the drops in. In less than a week, I was done. Stopped using them. Had an appointment scheduled in a couple weeks, and I would just tell them when I went to that appointment. And the first question they asked me is, "Are you using your drops?" Nope. I don't lie about it. I tell it up front. Nope. I told them I used them at first, but then they hurt my eyes. They burned. My eyes were red. Because of the side effects, I stopped. No one told me, and I didn't think anyone would give me drops that would actually hurt my eyes in order to help them. What I've learned now is that all drops have side effects. It's finding the drop that lowers your pressure with side effects you can tolerate. And that's the reality of it. I also didn't know about preservative-free drops at the time. And I've learned a lot about those as well. Most drops have a preservative called BAK. One of my doctors explained it to me that BAK is similar to bleach. So while you're putting the drops in your eye, you're putting the medicine along with a little bit of bleach. I don't know about you, but if you've ever had bleach spilled on your skin, it doesn't feel too good. So imagine that going in your eye every day. Some people have to have cornea transplants due to the ocular surface damage over the years from using drops for so long. Another challenge is doctor time, which is at a premium. There's simply not enough glaucoma specialists, and the rates of glaucoma are continuing to rise. Most patients see their doctor every 4 to 6 months. I go every 2 to 3 months. It's stressful for us patients. We are there at that appointment to find out if we've lost more sight. We get an eye exam, a visual field, or an OCT, and they test our pressure. My glaucoma specialist sees 75 to 100 patients a day on clinic days. This leaves very minimal time to spend with the patients. In that precious time, the doctor needs to examine my eyes, look over my tests, talk about treatment, possible changes, and then in what's left over, which is seconds, I get to ask the questions that I have. It's not enough time. Some patients just do whatever the doctor says and stop asking questions because they don't have enough time with their doctor. I don't do that anymore. I ask questions, but it's hard to get them all in. So thankfully for me, I have a group of doctors that helps me answer those questions. Finally, there are things that scare glaucoma patients that you might not think about. When we go out of town, we check to make sure we have our drops 2, 3, 4 times. When we cross the street, we look twice, 3 times to make sure that today is not the day that I lost another piece of sight and I'm not seeing a car that's coming at me. We lose contrast sensitivity and depth perception. So things are closer than they appear, kind of like your rearview mirror. Even putting a hat or sunglasses on can be scary because it's adding limits to our already limited field of view. It's the waiting and the wondering and the what ifs that can drive you crazy. Like Tom Petty sang, "The waiting is the hardest part." You guys didn't know you were getting a concert today too, did you? Well, we must learn to live in the unknown regarding our sight, and it can be a challenge. This is why patients seek me out. They can feel like one of millions with glaucoma, but to me, they're one of us. When patients feel seen and heard, there is a shift. When they understand their disease, their treatment options, and there is trust, they are compliant, bottom line. If patients are non-compliant, one of these 3 is missing. I think I need to repeat that because I've heard this several times at this meeting. If patients do not understand their disease, their treatment, and they do not have trust, They will not be compliant. They need this in order to use their drops. Trust and understanding is essential for compliance. I'm going to talk about that same University of Michigan study. They presented it at the AGS meeting in 2024. The results of the study showed, and I'm quoting, the program demonstrated that high-quality coaching and rapport building may help patients with previously low medication adherence feel more motivated and in control of their glaucoma, end quote. In addition, the words that patients used to describe how they felt after the study included understands, listens, kind, connected, encouraging. These words echo my initial statement about how understanding and trust lead to compliance. So how do I help patients begin putting the pieces back together? I meet patients where they are to find out what they need. I call it the 3 E's. The first E is emotion. If you don't get past the emotion, you'll never get to the facts. When I was trying to make sense of my diagnosis, I chose to be a bison. So what does that mean? Bison are the only animal that will run into a snowstorm as opposed to away from it because they know that walking into the storm will get them through it faster. I chose to turn into my diagnosis instead of running away from it, and I chose to focus on the 60% of sight that I still have instead of running away in fear. I choose to tell my story and help others through their snowstorms. I teach patients to find what's scaring them the most and to run into it until it no longer scares them. I believe that the more you speak it out loud, the more it doesn't hold you prisoner. It took some time, but once I ran into my diagnosis, I found peace. I was no longer in the storm. I had a patient who I coached who didn't want to go on living if he lost his sight. This is something that Lou brought up yesterday as well, and it's something that I've not just heard once or twice. At the time, he had no visual field loss whatsoever. But the thought of losing sight weighed heavily on him. So I asked him, should I go on knowing that I've lost 40% of my sight? He said, no, of course, you should go on. And I asked him why. As he responded, I quickly wrote down all the reasons he gave me. When he finished, I turned it around and said, let me tell you why you should go on living. And I repeated all those lines back to him. In that moment, he broke down and broke through the fear. I listened to him. That's what most patients want and need. The second E is education. I had unanswered questions at first. I didn't understand why I had glaucoma. I didn't know if what I was doing would help me. I didn't feel reassured and I didn't feel seen or heard. So I created my own last mile. This is something that Dr. Brandt talked about yesterday as well. So the last mile refers to the last point of service or delivery. If you think about a rural area next to a larger community, and that rural area isn't connected to the city's water and power and everything else. Once they are connected, that's that last mile. They're connected now to the larger community. I became that last mile for myself by researching what I needed to know in order to reduce the anxiety about my disease. In turn, I help patients by becoming their last mile. I answer their questions. I connect them with resources like the Glaucoma Foundation website, which has lots of information for newly diagnosed patients, questions and answers from glaucoma specialists. And there's also various webinars on topics of interest to patients. And I host the Glaucoma Foundation support group called APUP, which is Adult Patients Under Pressure. I lead the group and answer questions in order to direct patients to information and tools that they might need in order to make decisions regarding their treatment. This group gives people some control over a disease that is uncontrollable. The group helps each other. When a specific surgery is recommended for a patient, they can ask if others have had the same surgery and get their feedback on it. The group creates a safe environment for people to communicate and talk about their disease, share, and be supported. The third E is execution, a plan moving forward. So let's figure this out and make it work. Steve Jobs said, start with the customer experience and work back to the technology. What a powerful statement given the advent of AI. So I decided, what if I start with the patient? Start with the patient and work backwards. Work back to the doctor, work back to the tech, work back to the industry that's creating the treatments for us patients. Using that as my touchstone, I did just that. I started managing my own doctor to get what I needed. I made a list of questions before each appointment. I took my experience at my appointments and I worked back to figure out what I could do to change them and make them better, so I felt good when I left the office. I help to empower patients to get a second, third, or fourth opinion if that is what they need in order to move forward. I help them to create a step-by-step plan, putting them in the driver's seat and teaching them how to advocate for themselves. That is always the ultimate goal, is to teach people how to advocate for themselves. I have a patient that I speak with at least once a month. She's been to several different glaucoma specialists. She has excellent doctors helping her. She herself has been in healthcare and counseling. She knows what she needs, and talking to me has become an integral part of her glaucoma treatment. I asked her for feedback on her sessions, and here's what she replied. That my coaching has been invaluable in the following ways: wealth of knowledge, connections with top specialists, depth of understanding of what it's like to be a glaucoma patient, positive focus on empowering me with clarity regarding specific actions I can take, availability during critical decision times, and finally, to talk at length and not just for 5 minutes with someone who is knowledgeable, caring, and listens. Every patient is different, but every patient deserves to be listened to. Their stories told on a larger scale. I'm a part of several different patient advocacy groups. I am a regular on Capitol Hill. I was just there last week advocating with a group of patients, and I was talking about the EDV Act. The EDV Act, for those of you who don't know, is the first federally funded program for early vision screening in children. So it's early detection for vision impairment in children. There's currently nothing in place federally. And also, Dr. Johnson and I were able to present at a congressional briefing on glaucoma. And I've also been with other patient groups. I've met people with many different diseases. Some patients have more common diseases like heart disease or cancer, and some have rare diseases like pulmonary hypertension and amyloidosis. As patients, we learn different strategies and mindsets from each other. Elena and the Glaucoma Foundation invite patients to be a part of this scientific meeting. The entirety of the patient experience is welcomed. My story is not edited, and my perspective is welcome. My mission is for scientific meetings and for industry meetings to incorporate patients into their medical congresses and sales meetings. Having patients speak and share their stories, daily challenges, and strategies that have helped them. Just like the Glaucoma Foundation is doing today, show glaucoma from the patient perspective. Start with the patient. There's beauty that comes from seeing things in a different way, an unexpected appreciation for the little things. For Patricia, she's creating art in a new and unexpected way before she lost her sight. One of the patients I work with has lost a considerable amount of sight, and yet she's an incredible bird photographer. Another one is completely blind, and he puts out monthly YouTube videos telling stories that resonate with him. It's an honor to hold patients' hands and walk beside them as they put their pieces together. And it's a gift to be asked to help a patient as they lean into their fear and vulnerability. So, how do the pieces of our stories fit together? And what is blindness anyway? So, blindness is not black and white like I used to believe. It's varying degrees of sight. So, the way I explain it to people who have no sight loss is think about making a puzzle. You've got this puzzle and you put it together, but there's some missing pieces. You're really frustrated because you really want to finish that puzzle. So, you look under the couch, the table. Maybe the dog ate the pieces. We don't know where they are. But you can still pretty much make out what that puzzle looks like. Well, with glaucoma, even though I've lost 40% of my sight, that's kind of how I see. I can still fit the pieces together because I have enough to make out what the puzzle looks like. It's scary to me to think that I might lose more pieces one day and that the pieces would no longer fit together. When you have sight loss, your central vision is very important because it connects everything. Once you lose your central vision, too many of those pieces don't fit together and you can't see what the puzzle looks like anymore. But that's true in life too. If we lose our central vision, our raison d'etre, our reason for being, then the pieces of our life don't fit together either. Here lies the secret of life. But you didn't think you were going to find that out either. So the secret of life to me is holding two competing beliefs at the same time. So on one hand, I completely understand the severity of my disease and the thought that I might lose more sight. And on the other hand, I have complete and absolute faith that I won't. The only thing we can control is our reaction and our focus. Shifting focus changes what you see, even if you can't see. I focus on this 60% of sight that I have instead of the 40% that I've lost. Where can you shift focus in your life and change what you see? Finally, I'll leave you with these 3 lessons. When you have the choice to run into a storm or away from it, choose to be a bison. Number 2, when you can bridge the gap, become the last mile. And number 3, when you have the opportunity to help patients, like each and every one of you does in here, always, always, always start with the patient. Finally, a huge thank you to the Glaucoma Foundation for everything you do and for continuing to set an example of what it's like when you truly start with the patient. Thank you.